All right, misconceptions about miscarriages. Over the years, the number one reason patients give me of why they keep miscarrying, according to their OBGYN or their traditional fertility specialist, is, you know, miscarriages just happen. We don't really know, they just happen. Or if they dug deep enough, oh, well, you have this chromosome disorder, and, um, you know, it's either we don't know, it's just part of the statistics, or you have a chromosome disorder, and therefore we have to go along this route of getting pregnant artificially, or you know surrogate or whatever, and you can't get pregnant. That's what I hear. You can't get pregnant because your body just can't conceive. You've had 3, 5, 7 miscarriages. The most that I've helped a woman that before me, she had 7 miscarriages, and she was able to conceive naturally. So, number one, your constitution is not strong enough. It's not just a statistics thing. I had a couple, they couldn't get pregnant with their second baby. They had they had 2 miscarriages. Just because a couple has a first or a second baby doesn't mean it doesn't hurt if it's a second or third. Or if you've never had a baby and now you are having these miscarriages, that causes these feelings of defeat, especially when your doctor tells you, your traditional doctor, fertility specialist or OBGYN says, we don't know why. But you start working with someone who's trained in proper natural health care, and they will break down to you, I will break down to you why specifically, which emotions are affecting your mindset to, and it's been causing you to have miscarriages, which is unheard of because most people don't talk about emotions. They just talk about emotions after you miscarry, but they don't talk about the emotions that happen before you miscarry. So we'll discuss that in private. That's a very long-winded answer. Your lifestyle. That's an important factor. And I say it quite frequently, but it's really in together we need to discuss your lifestyle. It's not just you're stressed out. It's not a blanket statement. You have to have a tailored treatment to understand how your lifestyle is affecting your specific fertility issues. Miscarriage is not something that just does not happen. There's a specific reason. When I say the word kidneys, I'm not talking about Western medicine kidneys, okay? I'm talking about a specific Chinese medicine definition of kidneys. And that's just one organ. The energy of your kidneys needs to be stronger. When does your Western fertility doctor, when does your OBGYN ever say, we're going to strengthen your kidneys? No, no, no. If there's a heart issue, a spleen issue, a gallbladder issue, just the spleen and gallbladder, oh, they're having issues, let's remove them. Well, did you know that that can really affect your fertility here if you don't have your spleen or gallbladder? Not that you can't get pregnant, but it's affecting you. When's the last time your traditional Western doctor said to you, let's relax your liver? No, you don't hear that. Or let's optimize your liver. No, no, no. We're going to watch the liver decline until you have cirrhosis of the liver. These are conversations that just don't happen with your traditional Western medical doctor. And so if the fertility specialists are usually from Western medicine, I mean, every fertility specialist I know, traditional fertility specialists I know, have the word MD behind their name. So they're not doing anything differently. You have blood pressure issues, you're going to get a drug. You have, diarrhea issues, you're going to get a drug. You can't get pregnant, you're going to get a drug. And not only are you going to get a drug, you're going to get a regimen of drugs that's going to cost thousands. Thousands. And then people are so desperate to have a baby, so they start looking, does my insurance cover it? Oh, well, basically it's free. I'm going to keep doing IVF. At what cost? At what cost? And ask yourself the question, why isn't my doctor talking to me about nutrition? Why isn't this fertility specialist asking about my sex life? Why isn't this fertility specialist asking about where I am in my mental state when it comes to getting pregnant? Their emotions are not addressed. They're never addressed. I have yet to work with a couple who did IVF or IUI in the past and spent thousands of dollars, thousands, whether it was 1,000 or 250,000, ever. It's just, let's do this, let's do this, let's do this. Never, what's going on with your life? Where's your stress level? How are you handling things? How are you taking in the information from your family and your cousin just got pregnant? Is that affecting you? You just got another invitation to a baby shower. How many untold miscarriages are happening? And no one wants to, these husbands and wives don't want to discuss it outside their homes. I'm going to discuss it because it's important. It matters. It matters. It's not something to brush under the rug. It matters. You need to understand that your overall health is important. So, if you want to understand why you keep having miscarriages, we have to look at the big picture. You have to look at how you're living, how you're eating, how you're thinking, what types of alternative healthcare lifestyle you're using, or is it all drugs? So, when we are together, we will talk about your reason why you are having miscarriages, and we will correct that. We will repair what's broken, and you can carry to full term. You can get pregnant naturally, carry to full term, and deliver a healthy, powerful baby.